Local programming on KRWG made possible in part by viewers like you. Thank you.
Welcome to Fronteras, to Changing America. I'm Edmundo Resendez. Sueann Kenney-Noziska is a licensed clinical social worker and registered play therapist supervisor who specializes in using play therapy in clinical practice with abused and traumatized children, adolescents, and families. Sueann is internationally recognized in the field of child abuse and is an author, guest lecturer, and international speaker. She currently practices in Las Cruces and is the clinical director of the Community Children's Advocacy Center. First, not much has changed in substance abuse treatment since Alcoholics Anonymous was first published in 1939. Now doctors are hailing a change in the way Medicaid approaches addiction, saying it could bring the field back into the medical fold. Here's the story.
This is the empty lot right here that used to have apartments and houses on it. The last apartment was abandoned and we used to always use there.
How often?
Almost every day.
Susan Ireland moved to Imperial County from San Bernardino 11 years ago to escape an abusive relationship, a painful custody battle, and a commanding heroin addiction. But the move was only the beginning of a long and windy road to recovery. Back then, heroin and meth trafficking were picking up there. The border-adjacent county was seeing the beginning of an epidemic, one officials say is making a comeback today.
It was easy access. I had a vehicle. I could drive to Mexicali or here to El Centro and pick up the drug easier.
Ireland spiraled, got well, and spiraled again over the next few years. The cycle made its last round when Child Protective Services stepped in.
They were going to adopt the young ones out. I overdosed on heroin and I was staying in a motel, and the guy that worked at the motel found me, raped me, and called the cops. And I woke up in the hospital 2 weeks later, clean and sober, pregnant. And that's why I'm clean and sober today.
The pregnancy and her legal trouble pushed her into parenting classes through the county's Behavioral Health Services Department, and that introduced her to a psychologist and group therapy. Michael Horn heads behavioral health in Imperial County. He says Ireland's indirect path to addiction treatment is common.
We get them into the prison system. We get them into the courts. We get them in the child welfare system. But they don't necessarily ever end up over in our system seeking substance abuse treatment.
Horn says that could soon change. California is the first state to opt into a Medicaid pilot that will allow health providers more flexibility in billing for substance abuse treatment. Historically, Medicaid, or Medi-Cal here in California, has largely only reimbursed counties for group therapy. Horn says better coverage could mainstream individual therapy, residential treatment, and medication for people with substance use disorders.
The overall goal is to finally get into modern times with the treatment of substance abuse. You know, we have kind of been saddled with a one-trick pony in treating substance abuse in this country for a long time.
And even support for that has been scant. Around 2010, the county ended most of its group sessions because Medi-Cal wasn't paying enough to cover overhead costs. It's a trend that's happening nationally. From 2003 to 2013, the number of state and local facilities treating substance abuse dropped 25%, while the number of for-profit facilities grew 34%. Zoom into Imperial County, and something a little different happened. County-supported centers closed their doors and outpatient services dwindled. But in a county known for low incomes and high unemployment rates, it wasn't for-profit centers that stepped in, it was churches.
This is where in the morning, they do their Bible study. They get in here and they have their little devotion. And they have a little Bible study right here.
Luis Barajas is a supervisor at the faith-based recovery home Turning Point in nearby Holtville. He was addicted to meth for 35 years before a court ordered him to Turning Point. Now he shares the scripture that helped him sober up.
To live right correctly, not to have to be dependent on that addiction. to be able to focus on God and let Him lead me through my life. Before it was the drugs leading me through everything I went through.
Turning Point is one of 7 homes in the area run by religious groups. Barajas says about 1,000 men come through his doors each year, about half because of court orders. Barajas doesn't have data on how many of them stay clean, but says there's no better way to help addicts.
I had a psychiatrist told me one year, how many years have you been, go to college to learn how to do this? And I told him I've never been to college. And I asked him, how many years have you been an addict? He says, I never in. So how do you know how that addict's feeling? How can you tell what that addict's going through? I know what he's going through because I've been down that same road he has.
Julie Myers is a San Diego-based psychologist specializing in addiction. She points out that there's no conclusive data showing faith-based homes like Turning Point or other self-help methods work. One reason is a lot of those programs lack follow-up, or they're altogether anonymous.
Most of my patients, probably 70% who are coming in with an addiction problem, have had multiple treatment failures. So they almost all have been in a 12-step model. Either they've just gone to AA themselves or they've gone to a rehab that's been 12-step.
Myers says to treat addiction, you have to get at the underlying mental health conditions driving the behavior. Susan Ireland says the personal insight she gained in therapy was instrumental in her recovery.
I wanted to know why I was feeling that way. I wanted to know why I felt everybody was seeing me the way that I thought they were. In all reality, it was just myself.
Behavioral health director Michael Horn says he doesn't plan to block the paths to recovery laid by religious groups and former users. He just hopes the new funding will open a few more.
She helps us with facilitating our Spanish individuals.
Ireland says it was the combination of professional treatment and various groups that got her clean and keep her clean today. She's working through the 12 steps a second time. This interview is step 5.
I have a recovery calendar on my phone of how many days clean and sober, minutes, and everything. So I have 7 years, 88 months, 383 weeks, 2,683 days, 64,404 hours clean and sober. And I carry this with me every day.
Megan Burks, KPBS News.
Welcome back to Fronteras, a Changing America. I'm Edmundo Resendez. Sueann Kenney-Noziska is our guest today. Sueann, welcome to Fronteras, a Changing America.
Thank you. Thank you for having me.
Sueann, child abuse is such a difficult subject. We hear about it in the news. It's widely reported when there's a case. Where is our community with regards to understanding child abuse, investigations, and interventions?
I think that our community has come a long way in recognizing the problem of child abuse and that it's very real in our community. I think one of the biggest barriers is that there's a lack of understanding about what actually happens during the investigation, who's involved in that, and then how that shapes the way we intervene.
Well, let's talk about the process, because you, as somebody who deals with this on a day-to-day basis, let's start with the forensic interview. What is that?
So the forensic interview is the fact-finding interview that's done at the beginning of a child abuse investigation. So when we think about doing investigations, it's multidisciplinary. So there's a number of different professionals involved. One of the very first people that interviews a child is the forensic interview. That's a neutral professional that's had specialized training, and the purpose of that interview is to gather facts about what did and what did not occur.
There is another process that's called the SANE evaluation. What is that?
The SANE evaluation, across the nation, it's referred to as a rape kit, but in our state and in our community, what we use is the SANE evaluation, which is the Sexual Assault Nurse Examiner's Evaluation. So that is a evidence gathering and part medical intervention if there's been a disclosure of childhood sexual abuse within a certain time frame. And that time frame is going to depend on how old the victim is. So if a victim is the age of 13 to 18, then the protocol to do a SANE evaluation is 5 days. So what that means is when a child 13 and up is doing their forensic interview, if there can be a timeline established that the last point of victimization was within the last 5 days, then a SANE evaluation is done. If the child is under 12, the protocol window shortens and it's 72 hours. So for kids 12 and under, if in their forensic interview there is a timeline that can be developed that indicates that the last point of contact was in the last 3 days, then they would do that medical evaluation. So these are done by specially trained nurses that have extensive training, and they utilize a colposcope, which is a tool that magnifies the area and can take photography. And the purpose of that particular investigation, or that piece of the investigation, is to see, is there medical evidence, is there any type of trauma to the genital areas. Depending on the age of the victim, that exam is going to look different. So for kids 13 and up, it looks very similar to a gynecological exam. So there's actually swabs that are inserted into the genitalia, into the vagina. For kids 12 and under, it's not intrusive at all. No swabs are inserted, but they still use the colposcope, which magnifies things, to see if there's injury and if there's any evidence that can be collected.
How traumatizing is it for the child to go through this process, and what role do parents that are not being accused of the child abuse, what role do the parents play in this to understand what's going on?
I think it's important for the non-offending parent to realize that we are as child-friendly as possible when it comes to conducting these evaluations. So it's a child-friendly room. And again, it's not intrusive or invasive for young children. So if parents understand that, then they're in a better position to support kids throughout this examination process. The custodial parent actually has the right to sign for that SANE evaluation for kids 12 and under. When a child is 13 and up, they are the ones that have to sign for that consent. And some kids choose to not get that examination.
Let's talk about the role of the Children's Advocacy Center. Who is involved in that?
Our Children's Advocacy Center is probably the biggest advance we've seen in the last year in our community. It's really transformed the way we respond as a team to child abuse investigations. So the CAC model, the Children's Advocacy model, has been a best practice for intervening and investigating child abuse cases for over 25 years. There's over 950 in the nation, and we just have our first full CAC in Las Cruces that opened up in the last year to 18 months. So it's a multidisciplinary agency, and instead of a child going to law enforcement to be interviewed, and then CYFD to be interviewed, and then the hospital for the SANE exam, and then to a medical evaluation for follow-up needs and a therapist, we bring all those services to the child. So the child comes to the CAC, and the forensic interviewer is there on site. Law enforcement, people from the district attorney's office, CYFD also have offices there. That forensic interview is then recorded, and it's viewed by all of the investigators. So if that's a law enforcement detective, if that's a CYFD investigator, if it's somebody from the DA's office, they're all present to watch that interview. And then that gives the investigators the opportunity to have the interviewer ask further questions if they're needed. So if a child in that interview were to disclose that sexual abuse within 5 days for somebody 12 and older, 13 and older, or 72 hours for somebody that's 12 and under, instead of sending the child to the SANE unit at the hospital, we have a SANE unit right there on site. And so the family is still there, it's still a child-friendly environment, and we have a SANE nurse that shows up to actually do the evaluation. We have advocates and case managers that link the family to services, and then we have a mental health component that does a full trauma-informed assessment to figure out what are the treatment needs of the child. So again, it is that best practice, and it brings everyone to the child. So it's less stressful and traumatic for the child and for the family.
We last had you on about 4 years ago, and we talked about some of the issues. How far have we come with understanding child abuse and getting out in the community and educating the community?
I do think we've come a long way. I've seen that firsthand over the last 4 years in our community. Again, I think the breakdown is understanding the different components. So not every child's going to have that SANE evaluation, and so families need to understand that. And just because there's not true findings in that evaluation does not mean that the abuse didn't happen. Same thing with CYFD. They might close a case because the non-offending parent's being protective, but because they closed the case doesn't mean that child abuse didn't happen. So I do think that we've made some strides in recognizing that it's a community problem, but we still need to understand the process and support that process.
In the case of offending parents, how difficult is it to separate the offending parent from the non-offending parent, and what roles come into play during this process?
That can be a very difficult call, especially because child abuse typically happens, and this is true for sexual abuse, in a family. So it's not strangers that are perpetrating on our children, it's family members. And so a lot of loyalties then get challenged. So if we have a child that discloses, I'm being sexually abused by my father, the mom's going to be in a loyalty conflict in many situations. So this is my husband, he's the father to my children, I don't think he would do this, but yet I have a child that's saying that it did happen. So it can often be difficult to be able to identify who that perpetrator is, and then have that non-offending parent be able to act protectively and put the child's needs first.
When it comes to child abuse, it might be difficult for a lot of people to understand that it's not the boogeyman stranger that's hiding behind the bushes that might cause this abuse. It's actually a family member. What kind of therapy is involved for perhaps the non-offending parent for somebody to talk to them about why they need to investigate the father or the uncle?
It's usually a process. We have professionals in our community, therapists such as myself, and we really recognize child abuse as a family system issue. And so we need to give support to that non-offending parent. And one of the first things we expect is that shock and that denial and that anger. And so being able to sit with the parent through that, but then again, help work towards them understanding your child is the one that needs protection. You need to support this investigation so that we can figure out what did or what did not happen, because then that's going to impact the interventions that we do.
Let's talk about the multidisciplinary team response. How does it respond to child abuse? What role does it play?
The multidisciplinary response basically means we're bringing all of the professionals, the key players, to the table when we're doing these investigations and making decisions about what the next step is. So we have, of course, I already mentioned the forensic interviewer and the SANE nurse who does the medical evaluation. We also can have Child Protective Services. In our community, that's known as CYFD. Their role is to look at, is this child's safety at immediate risk, or is their non-offending parent protective? So they make decisions about, can the child be safe and remain in their home, or does that child need to be taken into protective custody? We also have law enforcement. They're looking at what are the criminal violations that may have occurred in this case, and what kind of evidence can we collect. We also have our district attorney's office, and then they work with law enforcement to figure out, do we have enough evidence to actually prosecute this particular case? And then we have therapists like myself and other providers in the community that look at how much trauma this child has, what are the child's needs, and then what are the family's needs to be able to heal and recover from child abuse.
So that's the multidisciplinary team response. What role does the Child Protective Services play in dealing with child abuse?
With Child Protective Services, and people need to be clear, the goal of Child Protective Services is to reunify families. It's not to take children away for forever. It is
There is this misperceptions that
Yes.
Child Protective Services is the one that comes in, takes the kids away, and they might not be viewed in a positive light.
I believe that our CYFD workers are probably the most misunderstood and probably underappreciated professionals in our community. They are tasked to do an incredibly important job with very vulnerable children and families, and their decisions are guided by mandates and policies. People have a misperception that, Child Protective Services removes kids and then they're supposed to protect them for forever. The goal, again, is to reunify children with their families. And so CYFD makes decisions about, is this child going to be safe in the home? Do we need to place this child with a relative or in a foster care while the family gets services so we eventually can reunify?
How about foster care? How is foster care in our community? Is it up to par where it needs to be?
I would say for the most part, the foster families that I interact with are very invested in children, and we have a lot of really good homes out there. We also have a shortage of homes because kids, when they get removed and they need a placement, if we don't have any openings, or if we have a family that can take one child, we have a sibling cluster of 5 kids, and we've got a family in Las Cruces that can take 1, and a family in Chaparral that can take 3 of them, and another family in Radium Springs that can take 1. Now we're looking at dividing children, and that's not the ideal way to go. But again, most foster parents are in it for the right reasons, and we have some really good foster homes out there.
Let's talk about law enforcement. What role does law enforcement play into immediate response with regards to a report of child abuse?
Part of it depends on where the call originates from. Some reports of child abuse actually go 911, and law enforcement is the first people notified, so they're the first ones on scene. We also need to remember that Child Protective Services cannot remove children in our state. Law enforcement removes the children and turns the custody over to CPS. So if law enforcement is on scene and they believe this is going to be something that could go criminal and we're going to be arresting one or both of the parents, they will then contact CYFD, who has to immediately send a worker out to take custody of those children and find a foster care placement. And that can be really hard when it's 2 o'clock in the morning on a Saturday and they have to make these decisions. So sometimes the calls come through our SCI unit, which is our statewide centralized intake. That's the 1-800 number. It can also be accessed by calling #SAFE from any cell phone. So that's a centralized unit, and I do believe that that's another stride we have in New Mexico. We have one number we can call, and then that call gets cross-reported to CYFD and to law enforcement. So it may go then to CYFD, and a supervisor screens it in and says, yes, this is a protective issue. The offender's still in the home. There's bruises on the child. We need to send someone out. And simultaneously it goes to law enforcement. And then they make a decision, is this something that reaches that criminal statute, and do we need to send a detective out? So there can be 2 investigations going on at the same time. A CYFD investigation that looks at immediate safety, child protection, and intervention. And then there is the legal investigation, which involves law enforcement and whether or not there's going to be criminal charges.
Let's look at our different communities, because we have communities like Las Cruces, which is a city, but let's look at a community like Silver City or Deming. What challenges do those communities face when dealing with child abuse?
The biggest challenge is that there's not as many resources in Deming and Silver City and even in Chaparral as there are here in Las Cruces. So we do have the advantage of being a city and having law enforcement that's right here on site, and CYFD that's right here on site, and a full CAC that's right here on site, as opposed to some of our smaller, more isolated communities. They just don't have all the resources that they need.
Part of the process that happens is the forensic interview. Who conducts the forensic interview?
The
Who's in
forensic
charge?
interview, it's coordinated through a multidisciplinary decision making. The only people who can initiate forensic interviews are law enforcement, CYFD, and the district attorney's office. So if a parent is concerned about their child being sexually abused, they can't just call the CAC and say, we want a forensic interview. So it has to be scheduled. Law enforcement or CYFD or the DA's office will call and say, we have a case, it's a 13-year-old child, we're going to bring her in for an interview, what do you have open? And we can interview 24/7, 7 days a week. 365 days a year. So we try to have that interview as soon as possible. So once the family comes and law enforcement and CYFD and or the DA's office is there, they meet with the forensic interview, and then that's how decisions get made about how the forensic interview is going to unfold.
Let's talk about looking down the road, for these families, for these children. What treatment options are available for victims of child abuse?
In terms of the treatment piece of it, what our big push for and our big trend is in the treatment field, and the treatment has to be done by a therapist, different from a forensic interviewer. Forensic interviewers are involved for the fact finding, they remain neutral, and they usually have one interview with that child. Therapists, on the the other hand, we're not looking at the facts, we're looking at the symptoms and the trauma and how to reduce that. We have a much longer relationship with those kids and those families. So our evidence-based treatments are what are most supported when it comes to intervening for child abuse. So these are different protocols that have been actually studied and have research for being effective at reducing some of the core treatment issues for traumatized children. One of the big ones is called trauma-focused cognitive behavioral therapy. We often refer to that simply as TFCBT. There's other evidence-based protocols. Child-parent psychotherapy, CPP, is also an evidence-based protocol. EMDR, eye movement desensitization and reprocessing, is an evidence-based protocol. So majority of our providers in our community, including myself, have training in one or more of these evidence-based treatments. So then when kids come into our door, then we make decisions about, is an evidence-based treatment the best way to help this child? Do they have other needs? And do we need to interweave other types of approaches to our treatment?
Sueann, why don't you give out the telephone number where people can get a hold of you or if they have questions?
If they have questions about childhood abuse and treatment, my office number is 524-9157. And if they have questions about the Children's Advocacy Center, that phone number is 556-9486.
Sueann, I want to thank you very much for coming back to Fronteras and Changing America and joining us. And want to wish you the best of luck.
Thank you very much for having me.
Thank you for joining us on Fronteras and Changing America. I'm Edmundo Resendez. Thank you.